So with Signature Primary Care and direct primary care in general, you have direct access to me. So how could that be helpful? Well, right now you may call and have a question, or probably you don't call first because you know that might be a hassle. You get on the computer and you ask Dr. Google and you research and you think about it and you let it go for a couple days, and then you call and talk to a MA or a nurse, and you're thinking, is that really what I want? Or does she really know me? It's Dr. Paige who really knows me, and I really want to ask her. And then maybe things stew along for a few more days and you think, oh, I just really need to get in. This is not going away. I need to talk directly to Dr. Paige. And then unfortunately, maybe I'm not available for a week, and you might be asked to see a nurse practitioner for an acute problem. And that still doesn't provide the reassurance that you're getting care from someone who knows you. And so with direct primary care, the access is directly with me. If you have a problem that you feel needs to have my opinion to make you feel reassured, you will get my opinion straight away. And if it's an urgent issue, if it's after hours, you get my opinion straight away. If it's noon, we say, come on in, let's chat about it. Come in today, come in tomorrow. If it's something we can take care of by text, we take care of it by text. If it's something that we sit down for 45 minutes in the office and hash out, we sit down for 45 minutes in the office and hash out. So a direct access to a physician helps you catch things early, helps you be reassured, helps you plan your life. You're not stuck out on the road and on vacation somewhere and wondering, oh my gosh, does my kid have an ear infection? And you know, what should I do? You know, you have access to someone who knows you. And it just makes everything so much more streamlined and comfortable and convenient. So prescriptions work a little differently with direct primary care, or they could work a little differently. Some prescriptions might continue to be cheaper through insurance, but what we found is that when we can carry the top 150, 200 medicines right there in our office, that we can buy them pennies on the dollar. And we pass that savings right over to you. We do not mark up those prescriptions above and beyond what it costs us to provide that service. And so it's amazing, really, how much hassle that cuts out. You may have noticed now that, gosh, your insurance says that a certain prescription costs $10, but then if you go to CVS, you know, maybe you can buy it for cash for $8, or maybe it's $5. Maybe with us it would be $2, because we really do pass along all the savings that we can get as a wholesaler to you. So when we talk about an enhanced visit with Signature Primary Care, it may be something you're not familiar with. A lot of people aren't. Right now, we're really used to going to the doctor, signing in, being rushed back, we get our vital sign, we sit down, we wait, and then the doctor comes in and we try to be on our game and we say everything we need to say and we take care of as many problems, but really did we get to say everything we wanted to say? No, we never do. And so with Signature Primary Care, I want everything to be relaxed. I want you to feel welcome in a very pleasant environment, non-threatening, non-medical. And when you come in, it will be a conversation. We'll lay out everything on the table. Hey, this is what's on our mind. And we'll be able to really handle all the issues that you need addressed. And, you know, that's not to say that every visit's going to be an hour. Sometimes you have strep throat, you need an antibiotic, and you're on your way, and that's what we need to provide. We need to provide quick and convenient care. But sometimes we have things to chat about, and you won't feel rushed in my office. I'm an osteopathic family physician, and osteopathic physicians are trained to look at the body as a whole, mind, body, and spirit. And so in the current system, I felt very inhibited. You know, it was hard to really look at the total person in 10 minutes handling 5 different problems. So Signature Primary Care really is what gives me the tool to embrace a real wellness philosophy. We don't want to wait till things are broken till we fix them. And we don't want to just look at physical ailments. We want to look at what your body's telling you and we want to look at your lifestyle. We want to look at nutrition and activity and stressors and relationships and overall life happiness and joy, because those things aren't just frou-frou. Those are related to your physical health, and it's important that we honor that connection. And so Signature Primary Care really is the only way that I can continue to focus on that and really elevate the level of care that I'm able to provide. And right now I'm just not able to do that. So direct access, it's cool, right? I mean, it can be as technologically advanced as you want it to be, or it could be really old-fashioned. You can mail me a letter if you want to, but we can Skype, we can text. The Twine platform is super cool. It is not just an EMR, not just a coaching platform, not just a portal, patient portal to nowhere that everybody's asking you to sign up for, but it's video chat, it's text chat, I can attach messages to you. It really is a way for you to tell your story and co-create your story. You see everything that's in your chart. There's no ifs, ands, or buts, so you know that your story has been heard. So we can relate the old-fashioned way. I can come to your house. Sometimes home visits might be necessary. It's hard when you're sick to get out of the house, right? Or you may come to the office. We may text, we may Skype. Whatever we feel is best for the situation, we'll do it. Technology is really all about connection, right? And we want meaningful connection, and we want connection that matches the situation. So if you're having an urgent issue, that's a pick up the phone and call issue. If you have a couple questions that you think of at 3 a.m, you can shoot me an email. If there's something you want me to see, maybe it's Skype. So it's really all about personalizing our relationship and figuring out the way to connect that's best for you. And you know, if all the Skyping and the texting and the Twine platform is overwhelming, that's fine too. Someone's gonna answer the phone when you call. We're gonna be able to see each other in person. Like I said, you can mail me a letter if you want to, but I want to be a little more quickly available than that. So there's lots of options to connect. Whatever way we need to connect directly, we're going to do that. It's not going to be based on what your insurance says that I have to do, or the box that I have to check to get paid by your insurance company. It's going to be based on what is best for you. I enjoy being an independent physician, and that means I can choose the best and the brightest from all local physicians, all national physicians. There are times where specialty care might be necessary. Like I said, when primary care is unrushed and personalized, and we have time to focus on you, specialty care is a lot less necessary than it is these days. But if a specialist if it becomes apparent that we want to consult with a specialist, we have a couple options. We can make an appointment with somewhere local, or we are a member of a nationwide network of specialists that I have virtual consultation with whenever I want. Like you can imagine, not all care has to take place face-to-face. If I have a question about your care, or we want a second opinion from a specialist, I can present your situation and your data and your story to the specialist to get that opinion without you having to leave your couch. So sometimes when we have a question, I can just pick up the phone and get a consultation without you having to pay for it. There are still times, of course, that you will want to sit face-to-face with a specialist, and we'll make that happen. But participating in this virtual network of specialists has been shown to cut down those consultations by really over 50%, and that's a lot of money saved. Because I have a really limited number of patients, I will have the ability to reach out to you. So it's the little things, like calling you up to make sure you're feeling better, or if you're in the hospital, checking on you and making sure you understand every step of the way what your treatment is entailing. Knowing that maybe your blood sugar wasn't so great at the last visit, and checking in and making sure you're logging your blood sugars. I can be there every step of the way, not to just wait for you to come to me, but to reach out to you to make sure that we're partnering in the best way possible. So a summary of your signature primary care benefits are a consistent and affordable monthly fee, a true wellness focus that focuses on you, body, mind, and spirit, direct access to me via Skype, text, the Twine platform, wholesale medications, wholesale lab testing, and wholesale diagnostic studies, access to a nationwide virtual network of specialists for free. So a lot of patients understandably wonder, how does this pricing actually work? This membership fee, what does it cost? And I think there's a lot of questions because it's just so surprisingly simple. We think it's too good to be true, but we establish a fee and that's what you pay. That's what you pay for the life of your membership. And that fee includes everything that I do in primary care. And so you'll never be charged extra in our office for something that is medically necessary relevant to your condition, ever. In addition to the care that I can provide, you also get a lot of wholesale benefits. So there are things that I can negotiate, like medicines, like laboratory tests, like diagnostic procedures, x-rays, MRIs, CAT scans. Now, sometimes those things might be cheaper through your insurance company, but sometimes if I have contracted with a particular private provider, then you can get those items at a wholesale rate. I am so excited to be offering Signature Primary Care to my patients. If you feel like it's a good fit for you and your family, go to drpaige.com, hit the enroll button, and jump on board.